Now, we've shown that we can work together to create better opportunities for all Missourians. Just look at what we're doing together to serve Missourians with disabilities and mental illness. In 2010, we passed landmark legislation to require insurance companies to cover the diagnosis and treatment of autism spectrum disorders. And what a difference it has made for our kids. Today, because of this law, 1.6 million Missourians have coverage for these proven treatments, and more than 2,500 Missourians were treated for autism spectrum disorder last year. Thank you. Thank you. Now, our Partnership for Hope continues to be a tremendous and life-changing success for thousands of Missourians with developmental disabilities. My budget expands this vital program to even more Missourians in more communities across our great state. For years, thousands of Missourians with developmental disabilities were forced to wait months, often years, to get the in-home Medicaid services they needed. People like Nate Huffman from St. Peter's, who I met when we first launched the Partnership for Hope back in 2010. Back when he was in school, Nate had access to physical therapy and other services that helped him be more independent. He'd even gotten strong enough to walk around his high school track. But when he graduated, those services ended. For 8 years, Nate's condition and quality of life worsened while he was placed on a waiting list for in-home services. 8 years. It was heartbreaking. But that was before the Partnership for Hope. Today, Nate is doing much better. His physical therapy is going well, and he's able to communicate through a new computer system. He told me that his goal was to someday to be able to walk around that track again, and thanks to the Partnership for Hope, he's getting closer to reaching that goal each and every day. Because of Missourians like Nate, each year I've been in office, we've made it a priority to chip away at that waiting list. And now I'm proud to report this year, that waiting list will no longer exist. Our friends and neighbors will now get the life-changing services they need when they need them. Now, on mental illness, as tragedies across the nation expose dangerous gaps in our country's mental health safety net, we took action here in Missouri. We added new mental health liaisons at each of our 29 community mental health centers so that our law enforcement officers can focus on being cops, not frontline caregivers. We launched 7 targeted emergency room response teams to ease the burden on our doctors and nurses. And we made a historic investment in mental health first aid training so that more teachers, clergy, first responders, and ordinary citizens can identify the signs of mental illness and know what to do. Together, we are training more than 1,000 Missourians on these proven life-saving techniques, and with your help this session, we'll train thousands more. But as any member of law enforcement can tell you, there are those for whom preventative services are simply not enough. Some mental illnesses are so severe that those suffering from them are a danger to themselves and others. Since 1851, this care has been provided at the Fulton State Mental Hospital, Missouri's only maximum security psychiatric facility, a facility that is crumbling and in desperate need of replacement. It's inadequate to its patients, it's dangerous for the staff who care for them, and it's an embarrassment to our state. Now is the time to take action. That's why I look forward to working with you to address this most urgent of needs and issue bonds to support the construction of a new mental hospital in Fulton. Interest rates are low, our credit rating is high, and the need is undeniable. Friends, let's roll up our sleeves, work together, and for the safety of all of our communities, get it done this year. Now, and as we intensify our efforts to make sure that Missourians with mental illness and developmental disabilities get the appropriate care, it's clear that we need more qualified professionals to provide that care. Just look at the numbers. 104 of Missouri's 114 counties are designated as mental health professional shortage areas. 72 counties even lack a licensed psychiatrist. These are good jobs that are in demand now. We just need the qualified professionals to fill them. That is why my budget includes a $20 million investment to help our community colleges and universities train 1,200 more mental health professionals. To do this. From teaching a child with autism how to interact with peers, to helping law enforcement respond to individuals in mental health crisis, these health professionals will help keep our community safe and make sure all Missourians have the opportunity to live up to their God-given potential.